Well, it is 6 o'clock. Good morning, good day, good afternoon, good evening to all our friends, participants, and collaborators. My name is Kimberly Conley. I am the Senior International Officer at the University of Kansas Medical Center and the Director of the Office of International Programs. I would like to thank all of our panelists and our small team of organizers, Dr. Michelle Cochran, Dr. Erica Sander-Stier, Alexa Smith, Stacy Rader, and myself, who have been meeting for 8 months to facilitate this discussion. As stated in our advertising, this is our second annual roundtable. And the purpose of our roundtable is to bring professional educators together as learners. Educators inherently have one thing in common, a desire to learn from others. They have this innate curiosity. And so Dr. Michelle Cochran wanted to provide a platform where people from around the world could come together, share ideas, and create a community of learners. This collaboration allows us to create kind of a consortium of individuals who share in the desire to collaborate, to connect, and to contribute to healthcare educators and the delivery of care around the world. I'd like to introduce, first, we're going to talk about continuing education. If to receive continuing education credit or a certificate of attendance, we're going to ask you to follow the directions. This will also be added to our chat, so you will be able to do this. Next slide. All of this is information for the continuing education. So if you want credit, please look for that also in the chat. So tonight's roundtable will be hosted by Erica Sander-Stier, and she will be introducing each of our panelists as it's their turn to talk. Erica Sander-Stier is a PhD, RN, clinical assistant professor, and educator at the University of Kansas Medical Center. Dr. Sander-Stier earned her PhD in nursing and BSN from the University of Missouri, Kansas City, and holds certified online instructor designation. Dr. Sander-Stier's early research on communication patterns to prevent turnover in newly licensed nurses has expanded to explore generational perceptions, nursing work, and aspects of job satisfaction among nurses in multiple countries. She is currently engaged in team science research exploring the impact of working in COVID-19 on the well-being of nurses and their intent to stay. She serves as an academic peer reviewer for multiple nursing journals and presents at conferences both regionally and internationally. And she will be our host for this evening. So Erica, thank you.
Thank you, Kimberly. It is my pleasure to be here tonight. And Dr. Michelle Cochran has been so kind as to host this with me and organize this event with me. I will be introducing each of our panelists prior to their presenting their presentation tonight. And our first panelist tonight is O'Brien Kilolo. Dr. Kilolo is a senior lecturer in the School of Nursing and Midwifery at Moi University in Kenya, and an adjunct assistant professor at Indiana University School of Nursing. He is a member of a global nursing collaborative that conducts systematic reviews to inform interventions for improving health outcomes in low and middle income countries. Additionally, he has interest in development of virtual platforms for advancing nurse training, education, and evaluation. Welcome, Dr. Kilolo.
Thank you so much, Erica. It's an honor and a privilege to be the first presenter in this second round table. I would like to present on what I'll call a WhatsApp consulting, a guiding training us for making clinical decisions on childcare. To contextualize my talk, I would like to say the following. One, there's a very high mobile phone penetration in Kenya. Indeed, out of the 50 million population in Kenya, there are about 65 million mobile phone subscriptions for a penetration rate of about 33%. And also there are about close to 40 million smartphone subscription in Kenya, and the majority of these are owned by the youth, the young population. And also internet is pretty much cheap in Kenya compared to most of the other regions in Africa and probably globally as well. In the Moi University, Eldoret, Kenya, we use innovative, problem-based, highly inquisitive, student-centered approach to teaching and learning. And I'll be able to make reference to that in my presentation in a very short while. Now, WhatsApp consulting came up, which involved one-to-one consultation between a student and a faculty, arose out of probably necessity, but most certainly out of chance. When faced with very novice nursing students who are very inquisitive and they are going for clinical placement for the first time in the hospital, definitely they want somebody who can provide them with a support when need be in order to be able to develop the required competencies. And in our case, we insist on critical thinking and making clinical decisions. So having implemented a course in pediatric and child nursing for the last 5 years or so, I always insisted on the students that they say, go to the clinical areas, I'm always going to be a phone call away. But as you all understand, as very busy faculty, sometimes it's not possible to always be that phone call away. So it became necessary that I request the students indeed to just be able to text me with a short message when they need some form of help. Faced with very highly competing teaching administrative responsibilities, and also with limited or non-existent clinical preceptors for the nursing students in the clinical areas, it became necessary indeed to find a way whereby I can provide the support the students require remotely in order for them to be able to make those decisions at very critical moments during their clinical placements. However, it's important also to know that this consulting platform only would work in times when the faculty, which in reference to myself, was not available to support those students at that point in time when they needed me in the hospital. And the consulting would range from simple, what I may call them simple to me as a faculty, but to the novice nurses who are seeing patients for the first time might not necessarily be simple issue. So they call them simple yet very critical issue on the which might affect the overall outcome of the patients they are taking care of. For example, a student may want to know, hey, if the book says for this patient who has got a low SpO2, but yet on physical examination, the physiological changes do not really indicate a form of distress. What do I do? What do I balance on? Or what mode of oxygen administration I'm going to use? Or why are some of these patients receiving one form of medication or the other? These are simple questions to somebody who has had experience in the critical area, but not as simple as such to these newly recruited student nurses who are seeing patients for the first time. And that's when the issue of just sharing that question, what is happening here, and then I'll be able to challenge the students to think towards the correct direction. So that consultation does not and has never involved sharing of patients' information, of course, for purposes of preventing the privacy, protecting the privacy of those patients. But also, it was also not intended to change in any way the trajectory of care of the patients. Rather, it provided a short-term avenue where the preceptor, either myself or predominantly myself, but probably also our colleague, when they are not available, to provide them with some clarifications on our patient care matter, specifically to guide them, try to wrap up their mind about the case they are seeing to be able to make the correct decision about nursing care of the patient. So it was not changing in any way the medical care of the patient. More often than not, the consortium did not provide the students with the solutions. Rather, the faculty
Brian, your
post.
finger is covering your camera.
Oh, sorry. I'm using my telephone, and I think for some challenges I face along. Sorry, no problems. So it was not meant to provide solutions to the students, but rather the faculty is to pose questions akin to the probes we usually use in qualitative inquiry to trigger the students' self-inquisitiveness to think in a certain direction with the overarching aim of assisting the students to arrive at the most appropriate, thought out, evidence-based, contextually relevant care decision, nursing care decision. And there's always a follow-up with the students whenever the faculty got back to the clinical areas to be able to discuss further about this, and also to give feedback to the students about the decision they made when they were consulting use that text message. And if that clinical follow-up was not possible, the case would be discussed in the next full group meeting, where now the whole group will interrogate the case and then encourage more students to use a similar model going forward. So certainly there are certain challenges associated with such kind of student guidance using what I'm calling the WhatsApp consulting. Sometimes the faculty will receive an overwhelming number of text messages, and these overwhelming number of text messages, and also considering that the faculty was also having a competing priorities, administrative and academic, therefore may not be able to respond on time, and that can easily demoralize a student who wanted to get guidance on how to make that decision. And also there is a possibility, in order to share complete information to guide the student, there is a possibility that one patient's information might be inadvertently shared in that platform. And also it depended on how outgoing and motivated the student was to learn and to direct their own learning. As I conclude my talk, I would like to say that even though I'm demonstrating this as an avenue which can use to support students to make those simple clinical decisions, but this strategy has not been tested through research, and therefore we do not know yet to what extent this might be impacting on the students' learning and clinical decision model. As we move forward, probably over the next few years, we'll be able to test this empirically and be able to share this information with other scholars who might be able to use them to support their students in clinical setting. Thank you so much, colleagues. That's my brief presentation.
Thank you, O'Brien. I'm just going to add that we will have questions at the end and not between panelists. So if you would hold on to your questions or put them in the Q&A, that would be great. Thank you.
Thank you so much. Our next panelist is Yujiro Matsushi. Yujiro Matsushi belongs to neuroscience nursing and is exploring care in the area of neuroscience nursing from micro and macro perspectives, drawing on his experience in basic research. And he is coming to us from St. Luke's University in Tokyo, Japan today. Thank you, Yujiro.
Thank you so much. Can you hear me? Is it okay?
And
thank you so much.
I think Alexa has your slides. Is that right? Alexa, do you have his slides ready to go?
Okay.
Perfect.
Thank you. Thank you for giving me this opportunity for this presentation. I'd like to have a presentation entitled Educational Effectiveness and Ethics Issue Using Social Networks. As the next slide, first of all, Yes, thank you. First of all, let me brief in self-introduction. My name is Yujiro Matsuishi, and I graduated from St. Luke's International College in 2012. Have been teaching anatomy at St. Luke's International University since 2021. And the next slide. In terms of technology and learning with teaching, this time we are using ICT in our class. And we create a video of a class on knowledge. Sorry, the next slide. Yes, and displaying anatomy textbooks and writing on the iPad to provide knowledge based on the video. And in the next slide, since the number of people allowed in university was restricted due to the infection, we conduct a live supplementary class over 6 hours for each class, using 2 cameras with different angles and discussing with a chat to check the morphology of the organs. But this presentation, this time, I would like to share information about education from a broader perspective, especially regarding the use of social media technology. In the next slide, and many technologies are currently being used in the world. For example, in the next slide, and in particular, the use of robot technology and AI is often mentioned in the news. But the next slide, I believe that advancing communication technology and the influence of social media will have a profound impact on our education. I will show the next slide. In terms of the world's population growth is currently declining. But in the next slide, what about social media? Instagram now has over 1 billion users worldwide. In the last 7 years, the number of users have increased 1,000-fold. In the next slide, not only this, but also relatively new social media like TikTok are beginning to grow rapidly. TikTok has outpaced its competitors with exceptional growth rate and averaging 340 million new active members per year. But in the next slide, you may wonder, is social media a credible presence? The next slide, doubts have already been raised about the use of social media in other areas. Previous study already reported that having a social media presence must be exercised with care and purpose and transparency to maximize benefits and minimize harmful consequences. In the next slide, a different study in medical education also stated that key criticism focused on superficial learning and psychological safety and correctly identifying level of expertise and professionalism and ownership protection for content creators. Users have a limited way to manage risk. The next slide. However, I have now surveyed my followers on my social media account, and 97% of followers replied social media is a good platform for education, and 94% of followers replied social media should be used for the further nursing education. I definitely think this data contains a lot of bias. However, it is probably true that many people using social media think this way. The next slide. This is the last part of my presentation. In my opinion, using social media for education is maybe challenging to make official due to the fact that social media at this time point is causing many sort of problems. The next slide. However, I also believe that we are giving isolated people the opportunity to learn. The next slide. As a diverse student understanding, I believe it is beneficial to provide learning opportunities at any time of the day by using social media. The next slide. It may be possible to create a learning environment that is equal for all, no matter what state they are in. In the next slide. In summary, my opinion on the application of social media technology to nursing educations are all that is needed is to create rules for new technology, social media. That's all I have. Thank you.
Thank you, Yujiro. And Yujiro has an Instagram account where he posts videos to teach nursing skills to nursing students, and I am one of his followers, so be sure to check him out there. Our next panelist is Naomi Nancy. Naomi Nancy is working as an assistant professor in the College of Nursing at Christian Medical College in Vellore, India. She also serves as a nurse manager in the ENT department. She's interested in teaching medical surgical nursing and nursing research, and she's passionate about the use of technology and innovative teaching methodologies. Her clinical interests are with laryngectomies and their caregivers. She is involved with initiating a nurse-led program for laryngectomies and their caregivers at the Christian Medical College in Vellore. And she has done a research fellowship at KUMC in Kansas here in the United States. Welcome, Naomi.
Thank you for this opportunity. And my presentation is on game-based learning. And the nationwide corona pandemic in 2020 actually brought a lockdown, and it kind of enforced schools and colleges across India to temporarily shut down to prevent the spread of virus. And this unprecedented change created a big gap in the education system. So the central and the state governments did their best to provide for online learning. And several institutions in the country initiated online learning to help students continue their education with ease from their homes. And it is creditable that educational institutions switched to virtual classroom after undertaking the license of various platforms like Zoom, Microsoft Teams, and Google Hangouts. And online learning tools also emerged as a boon during this pandemic. And I teach the undergraduate nursing students, the diploma nursing and the BSc nursing program here at Christian Medical College, Vellore. And we were fortunate to get the license of the Microsoft Teams for our online teaching. And traditional teaching has been the norm, especially for the undergraduate students, mainly in terms of the classroom education. And quickly to move into online teaching was a big deal for us due to various factors. So we started our classroom lectures and clinical teachings through online platform, which is Microsoft Teams. And over time, as we were teaching, I realized that students were not very active through our lectures and discussions over this platform. So hence, to break the monotony and increase the student activity, I wanted to use gamification, which is a part of game-based learning, which is adding more game elements to a non-game scenario where the assessment is not within the game. So I will be presenting to you on two such online tools that turn the entire system of learning more active and interactive for our nursing students. The first one is Quizzes, which uses gamification of quiz-based learning. It's primarily an online quiz-based tool that operates like a game show. So the Q&A works across web browsers and Chrome and iPhone and all Android devices. So I started building my lesson content with quizzes into this online tool and did a trial for my classroom teaching. And the students actually started enjoying it and the response was good. And also from a teacher's perspective, I also enjoyed it because I could get real-time immediate feedback from the students. Unlike the other asynchronous learning modules where the students lost their academic integrity and were playing around and felt it was not serving the purpose. Another advantage I found with this online tool is that we were able to overcome academic integrity in this tool because the teacher had the control over the session and the whole class had to go through the questions together with the question timers. Like I could set it up for 20 seconds to 30 seconds. It was an instructor-paced learning that happened along with the content, and we were able to move on. Since it worked out for my classroom theory education, I wanted to try it out for my clinical teachings with this online tool. And I was able to add videos and include concept checks with polls, which came in very handy with this app, both pre, during, and post video demonstrations of our clinical competencies. And also we could do this concept checks and quizzes at different steps of the procedures, which enabled us to understand the level of the students and their knowledge based on our video demonstrations. And I could also build in content with objectives and other informations along with this app. And from the students' perspectives, it also made learning more fun with game-based instruction and an ability to work through their own devices. Next, the features like leaderboards and rewards fostered competition and enabled active participation from students. And they were able to complete the assignments, and we had a real time feedback, and we could know the grades, and students were able to follow up on their grades. Mostly these introduction of games kind of broke the monotony and gave them probably a break with heavy content to avoid burnout and kept them refreshed and motivated. This is actually some of my content on this app, and this is an app, an online tool which is freely available, where I could build in my content with various activities that enable students. So the students actually logged into Microsoft Teams and participate in my class through this online tool called Quizzes, and all they needed was a game code, and they could just follow through my entire content along with concept checks, polls, and quizzes that kind of kept us active and motivated. Next, Flippity is another site that gave access to me to a variety of tools to use in the classroom that enhanced student experiences and engagement. And this Flippity next has around 27 different tools which work differently through Flippity site, and it is very unique and customizable with Google Spreadsheets as well. It has a variety of functions, so it provided with a multitude of digital activities and tools actually that can support knowledge assessment and learner-centered experiences. So we had a variety of assessment tools like quiz shows, where their virtual breakout activities can be given through this to check the comprehension of the students. And also there were self-assessment tools that could help the students and understand their feelings about their own activities. And we also had learner-centered tools, like there were manipulative tools and word clouds, which the students can learn through their entire process. So gamification using quizzes and Flippity kind of changed the entire learning environment for my students and fostered a lot of motivation and engagement in learning. And I want to conclude by saying technology in nursing education is really a boon and can make a huge impact, especially in the digital world. Thank you very much.
Thank you so much, Naomi, for that presentation. Next panelist we have is Erica Oda. Dr. Oda has graduated from St. Luke's College of Nursing in 2001. She graduated from a Master of Health Science from the University of Tokyo, Graduate School of Maternal Nursing and Midwifery in 2006, and she holds a PhD of Health Science from the same school in 2009. She has been involved in dissemination activities at the Cochrane Japan Center, conducting Cochrane Systematic Review Workshops as a vice president. She is currently a director of the International and Community Partnership Center, director of the World Health Organization Collaborating Center for Nursing Development in Primary Healthcare, and director of the Regional Collaboration Office for PCC Development at the International and Regional Collaboration Center, and associate editor of the Cochrane Pregnancy and Childbirth Group and Guideline Development Group, members of the World Health Organization Geneva headquarters. She has been involved in the development of the World Health Organization guidelines and collaborative research for the reproductive health and nutrition divisions. Welcome, Erica.
Thank you very much for introducing me, Erica. So I would like to move on to my slides. Thank you very much. So this is a picture of my university. And also soon, maybe 2 weeks later, we will see this cherry blossom blooming for spring time in Tokyo. Okay, so I would like to talk about my quarterly experiences. So although the COVID-19 pandemic disrupted and significantly limited study abroad programs, a collaborating online international learning COIL opportunity allow for graduate nursing students to actively engage in international collaboration and communication and problem solving. So known as both a teaching and learning framework and methodology, COIL facilitates virtual global learning by linking different classes from different countries and cultures. So aim of this COIL activity was to provide DNP and PhD students an opportunity to collaborate and create evidence-based creative solutions to global healthcare challenges. So next slide, please. So we use this Padlet for introducing each other before the classes. Okay, the next slides, please. So students from both countries worked in international teams of 4 to discuss healthcare challenges in both countries and select a challenge to work on. And we do group works and formulate PICOT questions and search and appraise the evidence. And also create a 3 to 4 minute Shark Tank pitch to sell their ideas to a panel of leaders from a fictional World Health Organizations. So 9 international teams entered the Shark Tank, and faculty plays a role of stakeholders from the World Health Organization looking to invest in evidence-based and creative solutions to existing health problems in both countries. So communication barriers were overcome using translation app like DeepL or Google Translate we use, and also we share the documents. And before the class, we use this Introducing to Evidence-Based e-learning program from Duke University called Evidence-Based Practice Series. And so all the students finish this e-learning program, and then they will formulate their PICOT questions. Okay, so the next slides, please. So winning proposal included a smoking cessation app that keeps users accountable and pushes positive reinforcement. And the second was our nurse peer support via telepeer app to reduce nursing workforce burnout. And the third one is screening tool and app, Mother's Matter, for postpartum depression. So these were the winning proposals for Shark Tank. In Japanese, actually this Shark Tank was originally a Japanese TV show, Mane no Tora, Money Tigers, and then they compete, they have competition for their idea, and the stakeholders will consider whether they will give money or not for that project. So we use this style. And students were surprised that many of the existing healthcare issues in the US are also primary problems in Japan. So both countries have the similar problems. And also the nurse burnout, graduate nurse retention, smoking and diabetes, colon cancer, postpartum depression, and social isolation were all addressed. Okay, so the next slides, please. So this is a word for one of the students from DNP in US. In working with international partners, we discovered our commonality and celebrated our differences and learned how to more effectively communicate. And also Japanese students said they learn a lot from US students, that they listen carefully to other students, and also they speak up their opinion. So the group work smoothly, well conducted. So they learn a lot from other countries' students. So by optimizing technology and flexibility, it is possible to provide graduate students with international opportunities to develop and improve their culture competence in teamwork, collaboration, and problem solving, critical thinking abilities, and presentation skills. Thank you very much for listening to my presentation. That's all from my side. Thank you.
Thank you, Erica, for that presentation. Our next panelist is Evelyn Rotich. Dr. Evelyn Rotich is a senior lecturer at Moi University in Kenya. She teaches both undergraduate and graduate midwifery courses, and she earned a BSc nursing degree from University of Eastern Africa, Baritan in 1997, a master's in science of nursing with a midwifery specialization from the University of Nairobi in 2006, and earned a PhD in nursing from the University of Cape Town in South Africa in 2020. Dr. Rotich has a wide experience in education, practice, regulation, and leadership. She served as a chairperson of the Nursing Council of Kenya and has served as a county executive committee member, regional minister in the county government of Uasin Gishu in Kenya. She is a recipient of Canadian Commonwealth Scholarship in 2012 and was attached to the University of Manitoba in Canada. She is a fellow of Sub-Saharan Africa, FAMER. Dr. Rotich's passion is compassionate quality healthcare and sharing what works. She is a champion of empowerment of adolescents and youth. Welcome, Dr. Rotich.
Thank you very much. I'm going to speak about OSCE. And OSCE is objective structured clinical examination. And with increasing evolution of education, there's also need to diversify assessment methods. And OSCE, the objective is scoring of multiple examiners in multiple stations. And the S stands for standardized format and procedures for all students across the different stations that are in an OSCE examination. And C are clinical skills that are assessed. And E, examining of student competencies with a wide range of scenarios. I've been able to use OSCE in examining students, year 1 medical and nursing students. I've also used OSCE in year 3 students. And I've also used OSCE in examining during continuous professional development when we are upgrading the knowledge and skills of healthcare providers. And OSCE was initially used in 1975. And at the moment, there is need to review its use. And I looked at some of the emerging issues in OSCE. And some of them include, first of all, the preparation during OSCE. Sometimes you find that there are students are engaged in OSCE without proper preparation. Sometimes you require to check the prior experience of students, whether they are first-time students, and probably during preparation, there's need to look into mock OSCE because of the simulation environment may not be what students really expect. There's also a need of preparation of examiners and looking at capacity of examiners to ensure that actually the presentation and the examination is objective. Another emerging issue is on organization of the OSCE. There's need now to look at the design, to design OSCE, looking at the time allocated. Sometimes you have about 8 scenarios, and you find that probably same equal time is allocated for all the scenarios. And this may not be really the required thing, because sometimes some scenarios may require more time and the students may move in a hurry from one station to another. Another issue is distraction from examiners for OSCE. How can we handle that? Because in a room, probably you have many examiners and there could be distractions, some reading questions and some asking students questions. And then also some other emerging issues is looking at oral narration versus written instructions. I think in other studies, you find that students are preferred to have the written instructions. So what are we using? I think the scenarios are used differently by different institutions. Another emerging issue is the number of stations. What is the recommended number of stations to ensure that the competencies are examined so that we are able to examine the knowledge, the skills, and the attitude? How many stations are required? The recommendation is 15 to 20 stations, but I have been in scenarios where you find that we have less, about 8. Then also the logistics around preparation for OSCE and the practice time before the students do the OSCE. And another emerging issue now is the use of OSCE during pandemics. We know that there was COVID-19 recently, and I think this posed a challenge to many institutions. They could not use OSCE, but the other alternatives of looking at, because it is simulation, you can do actually virtual OSCE. The benefits of OSCE, at least it is a clinical assessment tool, and it is conducted in an orderly manner. It is objective, and then there is inclusion of variety of stations, which allows for assessment of a range of clinical skills. And then the marking is standardized, unlike the clinical area where it is subjective, but for this there is more objectivity and you have more examiners. So that brings in more objectivity. And it is safe learning environment for students. And also this, it prevents, in the clinical scenario, sometimes the patients are afraid of learners performing some procedures on them because they are not really competent. And then assessment of critical care competencies can be used, and the students can practice in the OSCE so that they can be exposed to different scenarios and be able to practice there. If you compare a traditional method of examination in the clinical area and OSCE, the disadvantage for OSCE is that there is absence of real patient, and then this probably questions the authenticity of the exam. The traditional or word-based there is better clinical practice because there is one-on-one engagement with the patient. Then for the disadvantage of the traditional one, it's more subjective marking, and then there are few examiners. Usually you would find that in the traditional way, in the clinical area, you have 2 examiners examining 1 patient. And like in the OSCE, you have more than 8, depending on the number of stations, you have more examiners. And then not all cases also can be assessed through OSCE. That is another challenge in OSCE. And for challenges, other challenges in OSCE include it is costly. It requires multiple stations, multiple examiners, and also a lot of equipment. It is also high pressure because it has to be done within a certain time. So there's a lot of pressure. And the logistics in organizing for OSCE are many, unlike in the clinical area. Another issue that is coming up nowadays in OSCE is the importance of having debriefing. And it is important to do debriefing after the OSCE so that the students can be able to talk about how they felt, their emotional feelings after the OSCE, the preparation of the students, then also providing students with an opportunity to reflect on their outcomes. It is also important when you're doing debriefing to do debriefing outside the examination venue. That provides the relaxation. And then also it is important to look at the competencies of the person doing debriefing. So that is what I just have for the OSCE. And that is the end of my presentation. Thank you very much.
Thank you so much, Evelyn. Our next panelist is Dinesh Sumar. There we go. Kumar. Dinesh Kumar is working as an assistant professor in the College of Nursing, Christian Medical College in Vellore, South India. Dinesh started his career as an operating room nurse in neurosurgery OR. Following the certification in diabetes educator, he worked as a diabetic nurse counselor. He is currently serving in continuing nursing education and research department, looking after the research courses and short-term courses. He handles nursing education and emergency and nursing courses for the BSN program. Dinesh is an AHA certified BLS instructor, and he actively is involved in the training of healthcare professionals in BLS. His research interests include procedural pain, innovative technologies in education, and readiness for practice. Welcome, Dinesh.
Thank you, Ms. Erika, for the kind words of introduction. I bring greetings to you all from Christian Medical College, Vellore, India. At this time, take this opportunity to thank you for organizing this thought-provoking roundtable, as well as inviting me to be a part of this. Though my topic sounds similar to Ms. Naomi, my presentation will just augment her presentation. Being an educator in a developing country for over 8 years, I have seen a steep growth in the usage of ICT-enabled tools in the classroom teaching. This motivated me to explore on various ways to make these nursing classes interesting for the young minds. That is when I came across few gaming apps, which I have been using since then. But I must say that many in India are still getting a hang of technology. According to a survey conducted in 2022, it was found that 31% of teachers in India are still not proficient in handling the digital tools. Having given this background, I want to focus on 3 game-based strategies with varied levels of technologies which I had used. I'm sure most of the educators in developed countries may be using either this in their online or on-site classroom. Next slide, please. Clickers are designed to encourage class participation that uses advanced technology. It is a wireless response system that can be used in the classroom to anonymously and rapidly collect an answer to a question from every student. Commonly referred to as classroom response system or a clicker response system or a student response system, it consists of an hardware and a software that aid in teaching activities. It consists of an handheld device with multiple buttons that connects to a receiver. The responses are recorded and the software tabulates the results and present it as graph. In nursing education, it can be used for the recall of terminologies as well as the concepts. One of my colleagues had actually used this clicker in her research project and found that it quite captures the student attention well. And by looking at the responses, it actually fosters a discussion among the student group. It also enables a quick assessment since the responses are recorded and immediately presented as a graph. And based on the responses of students, it facilitates the pace of the students, whether they should increase the pace or decrease the pace or focus more on a particular topic. Having said that, we have certain setbacks in using the clickers. One that we thought could be the impulsive response by the students, because they are quite fast enough to respond, finally ending up giving a wrong response. And since it's a student-controlled response, the teacher will find it very difficult to engage them. And we also face certain technical glitches in terms of poor battery and poor signal from the transmitter and the receiver, as well as certain issues with the software as well. And I must say that in a developing country like India, usage of clickers is going to be quite expensive in terms of money, manpower, and material. Having said all, clickers is a wonderful tool to interact with students. But if, next slide, please. If the teacher is not very comfortable in using an advanced technology, I would suggest to go for a word wall, which uses a moderate level of technology. It is a virtual online platform that helps to create an interactive classroom for the students, either online or on site. All that the educator needs to do is just to select a template and then enter the contents into it. And that will actually create a very wonderful game which can be used for the students. In nursing, it can be used for priming the concepts prior to the lecture, or it could be even used after the lecture for clarifying the concepts. With my experience in using a word wall, I found that it quite enhances the impactful interactions among the students, and with the multiple options that are available, which are quite interesting for the students to take. Moreover, it directs the self-learning because it is quite self-paced. And from the teacher's point of view, it is quite user-friendly, and it has diverse option in it. I can switch the templates in between. I can edit the content as and when like, and I can also choose various themes and options that are available. And I can share it to my various platforms that are available, as well as I can embed it in a web page. Last but not the least, I can even have a tracking of all the students' progress. However, there are certain challenges in using this word wall. One that we could think is the participants' attitude towards taking this game. They found that taking a game is quite silly to use. And there are certain limited formatting options that are available. For example, the bold highlighting options are not available. That helps us to, that acts as one of the barrier. The other one is that the absence of import feature, which actually makes the teacher job a bit laborious. However, the word wall is a wonderful gaming software that you can use it for your students. Next slide, please. This slide is mainly for the teachers who are quite happy with using a very minimal level of technology. I'm sure most of the teachers from the developed countries would have already tried this, but we just started using this. One such is word search, where you can have a multiple terminologies or words that are very specific to a topic. You can jot down and then upload it in the software. That software will actually create a word maze, and that can be downloaded and printed and given to the students for introducing any concepts or topics. The next one that I'm going to talk about is the crossword puzzle, where the instructor can have a multiple responses with a clue that is provided for it, that could be uploaded in the software, and that will give you a creative word crossword puzzle, which can be again downloaded and printed and given to the students. The last one is quite exciting and very close to my heart. It requires a lot of time as a critical thinking from the instructor end, but it will be a wonderful tool and captures attention more. That is connected, which is using a picture clues to make the session quite interesting. All that the student need to do is just connect the clues of the picture and identify the terms or a word that is given there to introduce a concept. For example, I had used this picture clue is actually a basic famous personality, the Neil and the Armstrong. So Neil Armstrong. Likewise, it requires a lot of critical thinking and a lot of time from the instructor end, but it is a wonderful tool that I had most often used in my teaching. Next slide, please. We still have a long way to go. We are slowly marching towards achieving our idea in gamification and digitalizing our teaching. At this time, I would like to thank my alma mater, as well as the administrators and my friends and colleagues, well-wishers, for giving me being a great support for this presentation. I'm happy to hear from all the experts in this roundtable. Thank you for being a wonderful audience. Namaste from my end. Thank you.
Thank you so much, Dinesh, for all those great ideas. Our last panelist is Katie Ballaram. Katie Ballaram is finishing her final semester of the BSN to DNP program at the University of Kansas Medical Center here in the United States, with a focus on public health leadership. She is interested in directing an evidence-based lifestyle behavior program and integrating the pillars into the nursing curriculum and/or healthcare professionals' continuing education. She earned her MPH, Master's in Public Health, from the University of North Carolina, and her BSN from Truman State University in the United States. Katie's clinical experience is in labor and delivery, lactation consulting, and primary care. She also held leadership positions as general surgery orthopedic nurse manager and performance improvement hospital coordinator. Katie has enjoyed living 13 years overseas, learning about different cultures and customs. Welcome, Katie.
Thank you, Dr. Sonnersir, and also Dr. Cochran for inviting me to speak today. It's really an honor. Today, excuse me, I will discuss using Google Classrooms and WhatsApp to assess food quality and food insecurity. I was fortunate enough to have the opportunity to have a virtual overseas practicum through the Child Family Health International Organization, thanks to the generous funding of the KUMC Office of International Programs. So my project was to gather data through mixed methods to analyze food quality and food security, and then use that information to provide recommendations and also tailored health promotional educational materials. My preceptors, Dr. Martha Conseco Bennett and Eric Garcia, were wonderful to work with as they really connected food quality to the high prevalence of diabetes, hypertension, and other chronic diseases. So the organization they worked for supports students in an after-school program in Southern Mexico through tutoring, meals, and other services. But at the time of my practicum, it was closed due to the pandemic. So now Dr. Martha, she informed me that this quantitative survey was to be sent out on WhatsApp. And I was a little bit shocked. I'm like, wow, I better keep this brief, the questions. So I did a review of the literature, and I used the Latin American and Caribbean House Food Security Scale. And of course, the input from Dr. Martha and Ms. Garcia, who really informed this survey and made sure it was culturally appropriate. So we boiled it down to 14 multiple choice questions and 1 open response question, which the first few questions were on food insecurity, and the rest addressed food quality, such as the consumption of fruits and vegetables, sugar sweetened beverages, fried foods, protein sources, processed foods, and salt. So the next step was Dr. Martha translated the survey to Spanish, and she entered it into Google Forms and then posted it into my Google Classroom page. So on the left here, you can see I opened the nutrition survey that was on my page. And this is what it looked like after I pressed on that little plus sign that I circled there. It then pops up what it would look like if you were about to enter your own question. And you can see in the drop-down menu that you can choose to have it short answer. It could be a drop-down one, or like we chose multiple choice. And then down below, you can see Dr. Martha's question that she already completed down there. Now on the right, you'll see in order to send out this survey, so after it's totally populated and your survey's finished, you click on those 3 little dots, vertical dots, and it creates this drop-down menu. And Dr. Martha selected the Get Pre-Filled link. And then what she did is she took that and just pasted it into the cohort that we wanted to send the survey out to. And it sent it to them, and she said the recipients could see just 1 question at a time. They'd answer it, and then it would give them the next question. So now I had no idea how I was going to organize all this data in a short amount of time I had with them. I was picturing this massive list of handwritten data, the staff tract that I would need to tediously input into Excel. And I cannot tell you how amazed and quite frankly, utterly relieved when Dr. Martha showed me how to access the data. So on the next slide, so when I clicked on the nutrition survey that was on my Google Classrooms, what it did is showed me this little pencil at the bottom right that said edit. So I clicked on that edit, and then I could then manipulate it from the questions to responses, which is what you see highlighted in the middle. And so that opened up, and then I saw these beautiful pie charts of all of the multiple choice questions were automatically arranged into these pie charts. The questions on the top right, you can see there is a Google Translate function. So I could just toggle it over to English. It wasn't a perfect translation because what it did is only translated the question, but not the answers. But for me, it was okay. I had some Spanish background and I could always consult Dr. Martha. And then next you'll see the other circle I have. It says view in sheets. And what that does is it opens up all the data in like Google Sheets, which is like an Excel form. And of course, it was all nicely organized and you could kind of manipulate if you wanted different charts or whatever. But the open answer, we did have that one open answer. And of course, I had to organize that manually. And unfortunately, the translation didn't work on the Excel form. So it was all in Spanish. But I had help, of course, to translate it. Now, what this technology enabled me to do was spend more time then developing and sourcing targeted teaching materials. For example, the survey showed that over 90% always put salt on their food. So I developed educational materials to promote lower salt intake. Now you may be wondering, is this an acceptable format? In other words, what was the response rate? Well, for this cohort of about 165 students, our response rate from the parents was 87% in a 2-week window. Certainly acceptable for this population. Now, as I was preparing for this, I wondered if access to this method of inquiry was limited. So according to Statistica 2022, WhatsApp is the most popular mobile messenger app globally with around 2 billion active monthly users. In addition, about 86% of the global population owns a smartphone, according to the 2023 Statistica. So in conclusion, I hope you found this helpful. If you'd like to use this to evaluate learning with a quiz, survey, or just efficient data collection, I know it sure saved me a lot of time and really reduced my stress. So thank you.
Thank you so much, Katie. That concludes our panelist presentation this evening, which were all wonderful. And I know we're all thinking of ways that we can incorporate these technologies into our own teaching and maybe even clinical practice. We do have time for question and answer this evening. The panelists do have some prepared questions. I know I have lots of questions, but we're sure that you all do as well. So if you do have questions, we would ask that you put them in the chat and we will be watching the chat to go ahead and we'll read your question out to have a panelist answer them. If it is for a particular panelist, please do indicate that with your question as well so that we know how to direct it. I would like to start us all out as we get going by asking all of our panelists what the most challenging thing about implementing this technology was. What was the biggest challenge you faced implementing this technology for your purposes? I'm opening this to all of our panelists.
Yes, this is Brian Chelol. I'll go first and say one of my biggest challenges I always had is in try to guide our students to understand that it's improper to share information that might identify the patient, even though definitely as you share data to help somebody to make a clinical decisions, of course, there are certain variables within the patient information you have to share. But also balancing that with making sure that indeed we don't share identifiable patient information has always be a challenge. So it's still going to remain a challenge until you're at a point whereby we are able to tie around, going around what information is required to make a clinical decisions and how to balance that with the institutional policies around sharing of patient information. Thank you.
That's a great point because sometimes that sharing does get a little bit fuzzy or challenging with technology. Let's hear from the other panelists. Naomi, do you have a particular challenge you'd like to share?
Yeah. like Mr. Dinesh was mentioning, that we have a long road to move into using technology in our nursing education, especially coming from a low resource setting. We did have a lot of challenges when we started implementing online learning using different tools. And one of the biggest challenges were the infrastructural problems, like some of our students didn't even possess an Android phone for themselves. So getting them to learn through online teaching was really difficult, and with poor networks and in a country like ours with frequent power cuts, it was really hard for our students to actually log in and give actually attendance for their classes. And a lot of our students struggle to submit assignments on time with deadlines and with their power cards and poor network and poor bandwidths of networks. It was really difficult. Unlike the developed nation, low resource settings like ours, only a select few could enjoy such quality digital infrastructure. And so actually, if you look at our nursing education, we have a very good attendance of our students, but particularly during this pandemic, we saw a drastic dip in the online attendance, which is very uncommon in our professional education. Because their networks were very bad. I still even remember students could not participate in online tests, though they were mandatory, because sometimes there was only a single device in a particular family where the students, two of the siblings were also involved in online teaching, and our students actually went through quite a bit. So actually we had to come up with a lot of assessment plans also. So when we actually decided on our final assessment, we actually had to specify a ratio of online tests and offline tests, because we couldn't mandatorily say that we would take the online tests as well. So these were some of our challenges coming from a low resource setting, actually.
Thank you for sharing that, Naomi, because I think some of those are probably common for a lot of places, those challenges, and thinking about how to overcome them as well.
Another challenge that probably I didn't mention in OSCE is the complexity in designing the examination and the preparation. Sometimes also you find that students have other assignments or other activities like Viva after the OSCE, and if there are very many students who have to do, it means you have to have others in the waiting room. You have to have to look at a way that they don't really get, once a team has been assessed, that they don't meet the other team. So that is where the challenges really are. And then also, how many, I know 15 to 20 stations are recommended, but sometimes that may not even be enough to test the competencies of the students, because that it's not really all that can be done within an OSCE exam. That is what I noted that has been one of the challenges. Sure.
That's true, because Evelyn OSCEs often involve stations of competencies, and so that would be very difficult to do online, wouldn't it? Or did you use breakout rooms for that? How did you do that?
As a suggestion I was giving for virtual, it can be used, but I haven't done that. That is just our suggestion. I was saying a consideration that can be done is to give virtual, and probably breakout rooms would work for that.
Okay, good. What about our other panelists? Any other particular challenges that you faced? Or also the audience, we encourage you to put any comments that you have in the chat, or any technologies that you've used that you'd like to share in the chat as well.
Probably a common challenge is access to technology, especially with what I was evaluating, food insecurity. Even though participants could come to the center, and if they didn't have a smartphone and they could answer the survey, that costs time and possibly transportation to do that. And these are probably the ones that are most food insecure. potentially. So that is, you know, a limiting factor, unfortunately.
Good points.
Thank you, Katie. I'd like to echo Katie's opinion. Maybe, yeah, I think that towards new technologies not existed. So maybe we should make some rules and regulation. For example, maybe I forgot the ChatGPT is a big issue and big problem for educators. And yeah, maybe students can easy to write the report by ChatGPT, but it is new things. So there are no regulations and rules. But yeah, as I presented, I'd like to emphasize that using social media there's a big many merit for using, but there are no regulations at this time. So yeah, making some regulation is maybe the maybe making the rules or regulation, and also maybe self-judgment will be necessary for students and also for educators.
Professor Yujiro, I want to ask you a question. You have 49,000 followers, almost 50,000
Thank you.
followers. You're probably the most popular teacher here tonight with the largest breadth. That's really amazing to me. Just tell me how you started that. How did you get so many followers? And I also think that this is a testament to this is what people want. They want to learn through social media. So can you just talk a little bit about that?
Thank you. At first, I talk and I have many seminars on the academic position or as a researcher, but there is a very limited space, and maybe we have to talk same things on the different place. I think it's not good cost performance and time performance. So that's why I started YouTube and Instagram. Then I feel that YouTube and Instagram is very, I think it's very exciting also for the researchers. We can easy to feedback, and maybe in academic position or academic world, we can talk only by researchers. I think our research is for the people, so we can feedback by the people or patient. I think it's very good for the interaction.
It's interesting because we sometimes have research that's presented in really small segments, kind of like tonight, like a 5-minute presentation. I'm not a researcher. I have no science background, but when they're presented very short, I can understand, I can follow. And so I think that's what you're doing is you're appealing to like a larger crowd, right? Not just people who are in science, but people, like you said, the patients. And so it really gets to also like health literacy, right? You're providing health literacy research and science literacy to populations. So then my next question is, you talk about there needing to be rules or regulations. Will that be your next step? Is that something you're interested in doing and pursuing yourself?
Okay, thank you so much for your question. Maybe the influencers on SNS or social media is very good at making the contents, but they are not so much knowledge about the research and knowledge. They have knowledge, but not sufficient for the medical term or exact knowledge. So I think we have to collaborate with creators. I think we can make some research to collaborate with creator, then spread some research result. Think that we can feedback. I think maybe some people in this in here can make good research about these things.
Hello, everyone. I do have a question for Dr. Oda. This is Chiro from KU School of Nursing. When you conducted the COIL program, what were some of the challenges coming from the student in terms of coordinating time and coordinating and collaborating in their projects and assignments and whatnot, and in order for them to achieve the objectives of the course?
Well, thank you very much, Chito. Nice to meet you again. And yes, we have difficulties for the time differences in US and Japan. Like today, we made it for 4 countries, but so it's mostly in the morning at Japan time and US at nighttime. And then most of the students are working as it was DNP students. So they are full-time workers and then they have limited time. So it's pretty difficult to find the time to have a group sessions. So they what the student did is they set up the WhatsApp in the mobile phone, and then they communicate each other more easily than emails. And so, and also the Japanese students are pretty shy in the beginning. So we have to encourage them to speak up more. But I think US students leading very well, and they talk really nicely, and then also listen to Japanese students' comments. So it was really a great opportunity for our students to learn how US students lead people, and then also the team group working together really through the even the time differences, but they used WhatsApp and then also the Zoom or other things, and then they make times, and only they do 2-3 times meeting, and then after that they can do like 5 minutes presentation together. So we only have one time before and presentation, so only 2 times class, and also there's group work in each other. So we don't spend that much time, but we can do this kind of presentation. So it was a great experience for me too. Thank you very much.
Thank you. Thank you for your response.
Professor Oto, I'd just like to add, I was really interested to hear about your COIL as well, because we are also doing that at KU Med, as you know, and we've had the ability to have the virtual learning classroom with our friends at CMC in India, and also with Moy University. We've been doing that with Moy since 2020, fall 2020. And this semester we actually are have a specific virtual exchange. Dr. Cochran is leading it, so she might want to add something, but it's with our midwifery programs, which is incredibly interesting. And I will give just a little sneak peek that our next roundtable will be on midwifery. So Dr. Cochran, I don't know if you want to add something.
I'm actually probably trying to incorporate some sort of Shark Tank event in our next collaboration. That just sounds like that's so much more fun. We're so serious. I think what I'm taking away from all of this technology is let's find a way to engage and have fun as well as interact. So, but yes, our midwifery, we have our midwifery faculty from Moy here, and I'm interested in how you presented your collaboration. And I'm thinking one of the things you said is that after a couple of meetings, they can do a 5-minute presentation, where often we're thinking of longer periods of time, 15-minute conference type presentations. So as usual, the international perspective has opened my eyes to things that will make our classroom better.
I do want to make a comment on Dr. Kumar's presentation, because I really found it very interesting that with all the available technology we have for to use in education, it's always those simple tools that really give us the more bang to our buck, so to speak. And I do love the word puzzle and word search. I mean, there's actually a study done that the word search are one of the therapy that are used for patients who may have TBI or traumatic brain injury, and they use them to in the process of rehabilitation. And I myself have a book on my bedside, so if I can't sleep, I do that at night. So it's very helpful to for brain exercise. So I really appreciate you presenting that tonight.
Thank you, Dr. Chito, for the comments. Thank you.
And just a connection to that, Dinesh, today we had another presentation at noon, and we had our Professor Emeritus of Pathology, Dr. Ivan Demanov. He's a great educator. We have a recording of that. I'd love everybody to look at that on our page under Foundations of Global Health. He's originally from Europe, an incredible collaborator, and has made so many wonderful research progress and just discoveries. And he said that he just recently wrote an article on using games, and he's using Hangman to teach pathology terms. It's so simple. It's so simple, but at the end of the day, when you look at children and how quickly they learn, and they're learning through play, right? And then we get all serious, as Michelle said, and our learning slows down and we slow down. And we probably have it, backwards. If we kept playing and we kept learning through play, we would probably continue to learn at a faster pace. And that's one of the messages from Dr. Ivan today. He said, if it's not fun, it's not worth doing. That's what he said.
Kimberly, I love that you just shared that. And I just want to say that I just wrote down, use Hangman to learn terms for nursing research class, because some of the subjects that we teach students are not particularly interesting to them at when they first meet the topic, because I teach research to students that are not necessarily going to be researchers. And so any way that we can make it interesting is really beneficial, isn't it? Michelle, did you have, sorry, Dinesh, you have a comment?
Sorry, just because we mentioned about research, the word wall, which I was explaining, we were actually using it for our participants who were in the research course. So every day post session, we used to send this word wall games for them. Maybe focusing mainly on one game could be on sampling techniques. The other game could be on the terminologies that are used in the literature search. The other one could be of a sample size calculation, or maybe a data collection tool. So we run a 1-week program. So every day we use different games using the word wall. And we found it quite interesting, because most of the participants are quite adult learners, means in the PG level or maybe post PG. But they found it very interesting to take part in that game, because it's quite interactive, and they get to know their scoreboard and things and all. So it's quite fascinating to use that word wall.
Oh yeah, yeah. A scoreboard is really nice for them too, because they can monitor them. Oh, that's motivating, isn't it?
Yes.
Great,
Yes.
thank you. We have a question. Mbai, I'm not sure. You've got your hand up. Do you want to unmute yourself and ask your question? I'm sorry, I might not be pronouncing quite correctly, but the screen name that has their hand up for a question is MBAI.
Otherwise, they can put it in the chat. They might
Sure.
have accidentally put their hand up. I've done that before.
Hello.
Oh, there we
That's
go.
Mbai. Early morning, good morning all, and whatever time it is, that is Mbai II from
Okay.
Kenya. Have one comment. First, may I thank all the presenters. That was really wonderful presentation. I just have one comment or a question. I'd like to ask, in all this virtual learning, especially the clinical area, how do we ensure that each student is actively involved in that learning, given that sometimes we have quite large numbers? Maybe it's a question to all of us and to the presenters. Thank you. Ensuring that there's active learning and each student actually ends up learning that which is expected of him or her. Thanks.
Great question. We'll open that to all the panelists.
Yeah, probably I can go first. Again, this is Brian. I would say listening to Dinesh's presentation, and thank you, Dinesh, for a fantastic presentation. I think for clinical setup and from my experience, I think, and I raised this as a challenge, that not every student is motivated to use the technology either to consult or to learn. And Dinesh has really overemphasized the significance of including some forms of rewards in the use of technology for learning. So that will be probably be the next thing to think about. What forms of reward we need to introduce to this so that we can motivate the students who seem not to be so actively involved or not motivated, or probably just because of differences in personality. I think that would probably be the next step to explore. Thank you.
So is it okay to speak up? Sorry. Yeah. So our session, we tried to ask students, everyone have to speak up at once in the presentation. So no one left behind of the presentation, so that they can engage, everyone is engaging. So we check the participation for the presentation that they speak up or not. But they have to, at least one time, have to speak up in the presentation. Yes, so whole students have a chance to speak up. Thank you.
Naomi?
Yeah, answering to that question, and with regards to managing a big number of students, especially in the clinical areas, so we can divide them into clinical groups, into smaller groups. And one way we actually kind of ensure our objectives are met is our pre-assessment of knowledge using pre-tests and end of posting, post-assessment, either using a OSCE or using a post-test, using Q&A or quizzes has actually really helped. Like, we have a lot of traditional, though, like I said, we are into our way of moving ahead with digital technology, but we use a lot of other games and other methods which can really assess their knowledge. So one way is to divide them into clinical groups and also have a pre-assessment test in an end of posting OSCEs, and knowledge assessment will actually give an idea to the teacher how each individual is performing. Probably if not, you're not able to assess them through the delivery of your content.
We have time, I think, for one last question from Anne before we wrap up here. Anne, do you have a question you'd like to pose to the group?
Yes. Hello to everybody. In my place is Kenya. It's very early in the morning. Now I have one small question. At what stage, now that we are using a lot of technology, at what stage are the students exposed to really life in clinical experience? That is maybe to all the panelists. At what stage do you expose the student to really live clinical experience? Hello? Hello?
We hear you, Anne.
We can't hear you. We're contemplating the answers.
Yes, it's a good question. It's a good question.
Okay, thank you, thank you.
Yes, so there is a obviously a segue from technology to real patients, is what you're saying, and at what point do you transition from the technology and the games to real patients? So I think anybody can answer that, and not just our panelists. We have Dr. Cochran, Dr. Sanders Steer. Anybody want to?
To answer this question, maybe the technologies or a gamification, whichever we had mentioned from our setting, it will just augment the actual teaching that we do. So we actually expose our students early in their first year itself in a graded phase. So it doesn't compromise with the actual real life experience, whatever the game-based teaching that we do. I hope I answered your question.
So that means as we apply technology, is we run it concurrently with the really life. Is that so?
And your speaking of technology, your internet, I think it made your voice really slow, but I think just to kind of say, so, Dinesh is saying that the teaching, the clinical teaching and skills go on as normal, and the technology helps to reinforce what's already happening in the clinics, and it helps to augment or supplement the learning, and in some ways just help students to hold on to ideas and concepts.
Thank you. Thank you.
Thank you, Anne. Thank you for the question. And Dr. Cochran is going to do our closing remarks for us. Thank you, Dr. Cochran.
Yes, thank you. There is a final chat that Alexa posted on the follow-up email, and how you can get a copy of the PowerPoint and links to emails. I think there's been some questions for that. But thank you all to our panelists for their just excellent educational presentations. I've learned so much, but I also am so honored to be working with each of you and getting to know each of you, and you're each such accomplished individuals and educators. I love this tonight, learning about teaching and technology and learning about it through an international lens, because engaging with my international colleagues just reminds us that nursing is a global profession. We can incorporate our international lens in our professional identity. And our practices are enriched when we learn from each other, because many of us have found that our students' main takeaway is we're much more alike than different. So I hope everyone has obtained that tonight. And I thank you so much for our participants. Thank you for joining us tonight. This has been a real pleasure. Thank you, and good night and good day to our colleagues.
Thank you.
Thank you.
Michelle, probably you will share with us the contact of our fellow presenters, maybe on email or.
We will. So Alexa will send out an email to everyone who was registered for tonight. It'll include information on getting CE. It'll include the recording. It'll include the present PowerPoint, and it'll include the emails of those who were panelists as well. We also had an idea that maybe we should start a Padlet where we put all these ideas on the Padlet, and then also our participants, those who joined us tonight, could put their ideas. So I think this conversation will continue. Yay, which is what we want.
Thank you. Thank you.
Have a great
Good
day,
night.
everyone.
Thank you.
Bye-bye.
Thank you. Yay,
Sleep
good
well,
night.
Everlyn.
Bye.
Bye.
you.
Bye, everyone.